Leader of the Opposition, Keir Starmer.
Mr. Speaker, nurses going on strike is a badge of shame for this government. Instead of showing leadership, he's playing games with people's health. And there is a human cost. All he needs to do is meet the nurses. His inaction speaks volumes. As ever with this Prime Minister, it's Tory politics first, patients second. We've never seen a nurses' strike like this before. They've been forced into it because the government has broken the health system. Ask anyone in the NHS. They will tell you they don't have enough staff. 133,000 vacancies. And there's an obvious solution. Scrap the non-dom status and use the money to bring through the next generation of doctors and nurses. That's what Labour would do. Why hasn't he got the guts to do it? As usual, Mr. Speaker, he tries to blame everyone else. His department commissioned a report into the NHS which reported on Monday. That report said we've had 10 years of managed decline. It was not COVID. Responsibility is sitting right there. And the reason he can't choose nurses over non-doms is because he's too weak to stand up to the tax avoiders. For 12 years, they haven't trained enough doctors and nurses. So we have the absurd situation of the NHS spending billions on agency workers to fill the gap. Why should the country have to put up with money that should be spent treating patients being wasted plugging gaps instead? There he goes again, pretending everything is fine. Try telling that to those on waiting lists or those that can't afford to pay for a next-day GP appointment. After 12 years of Tory failure, winter has arrived for our public services. And we've got a Prime Minister who has curled up in a ball and gone into hibernation. If he can't act on behalf of patients or nurses or everyone who wants these strikes called off, then surely the whole country is entitled to ask, what is the point of him and what is the point of the government he's supposed to be leading?
Keir Starmer.
Mr. Speaker, under the last Labour government, we had fair pay for nurses and no strikes. So I won't be taking lectures from him about that.